I'm going to open the door now for some questions, maybe comments, but please, we need to keep those short. So be brief, to the point. The door is open. Yes, go ahead.
I'm unable to stand up because my desk is stuck. So I'm sitting down.
So a little bit of a functioning issue here. Thank you very much. The presentations were great, and it's really exciting to see this renewed interest in food security, agriculture, and nutrition, which is something that's been coming in and out of fashion for probably just under 100 years now, since the early 1920s and 30s. We just seem to have this amnesia as we go forward. But it's wonderful that you're all pinpointing very clear sort of ways technically to go forward. And I guess my concern or my challenge would be, and my interest would be, to hear from yourselves as from the positions where you're sitting, at university or research institute or the CGIAR, your feelings for how do we train people better for human resource capacity development, not just those of us fortunate enough to be in the room here today, but within Africa, Asia, Latin America. And where do those resources come from? Because in some regions, Africa for instance, we really do have a human resource crisis. There are just too few trained people with the skill sets we need. And so my question is, where can we find those resources? Because I would figure this is really an acute crisis that we're facing to move forward with these very good ideas. Thank you very much.
Thank you. Yes, right there. We have some. Yeah, it's good. So the microphone's right next to you.
Yeah. Look in the wrong direction here. Couple of things. Dr. Kaba highlighted what he identified as many, many weak linkages globally between agriculture and health and many organizations that have common interests in the issues we're talking about today. And our last speaker, Dr. Bengali, talked about the need to de-silo approaches in 3 or 4 different key areas that have all been highlighted today. My question is, from all 3 panelists' perspectives, can they identify any potentially unifying platforms that various stakeholders could come together on and unite their efforts to help understanding and informed decision-making, and will give them a common platform to debate, to develop consensus opinions that answer questions in the 4 areas, and then help disseminate that to encourage public understanding and more rapid implementation. I want to throw one idea into the debate, and that was a point that Dr. Kaba made about the significant importance of communications to enable understanding. And I'm wondering if this is a potential unifying platform whereby the various stakeholders come together and develop a unifying platform to answer these questions from a health perspective, from an ag perspective, from a consumer perspective. And I'm wondering if this is likely to be a focus of the conference that's coming up in February, and whether a workshop or stakeholder engagement a project around this area could both unify and develop outreach which will move everybody's mission forward. Now, if systems already exist around the world that are starting this, can we harness them, unify them, and I'd love to hear more about them.
Thank you. I have Barbara here, and then Barbara, and then we'll get.
Thank you. I found this really very interesting. In 1983, the London School of Hygiene and Tropical Medicine was asked to write a textbook on agricultural development and nutrition, and indeed it was published in about 1984. And nothing happened, mainly because those silos weren't breached, and there was a general retreat from investment and aid in agriculture. So now we're at a moment where these issues can be revisited. In the model of the factors that are really important in linking agriculture and nutrition, even though the elasticities are not very high, I wondered why land rights hasn't been mentioned, and why the quality of labour in agriculture has also not been mentioned, and incomes from small-scale production and from labour, in terms of the factors which actually make that link between agriculture and nutrition. Also, agricultural debt and the factors in engagement with markets. It's not a matter of market access, it's the terms and conditions of market access that prevent producers from getting more returns from their production and being able to save, invest and spend on food. So those are things which I think need to be added to the framework in the area of agricultural production. But that link, or the lack of link, between agriculture and nutrition is also a sphere of social reproduction. And there, Marie emphasized the 1,000 days. So onto the policy agenda ought to be maternity benefit for 1,000 days. Why not? If this period is so important to children, why can't maternity benefit be added to the social protection agenda? And last but not least, it was said by everybody that the concentration of poverty has changed regionally. And indeed, a lot of it is in India, and a lot of child nutrition is in India. So I was surprised that nobody mentioned the sex ratio, the different life chances between boys and girls, the fact that this is deep inside the family, deeply culturally embedded, but the child sex ratio is getting worse. And work I did in the 1980s, I reviewed all the literature on the relationship between mortality and malnutrition in South Asia, and it showed very clearly there was a strong problem of son preference which underlay mortality as well as nutrition.
I'll take one more question, and then we'll give a chance to our speakers to respond. Then if we have time, we'll go for a second round.
Thank you for great talks. I was just wondering, given the fact that the food processing sector seems to kind of relate the agricultural sector as well, to a certain extent, the nutrition portion of it. So I was wondering if there's any study being done that investigates the impact of the food processing sector and trade into the malnutrition issue, especially in regions where the obesity problem has become a simultaneous issue as undernourishment.
Thank you very much. Can we ask our panel to take up some of the issues? Marie, you want to start?
Marie, start.
Okay.
Thank you. I'll start with the training issue, human capacity development. About 4 weeks ago, there was a meeting in Lusaka of ministers of agriculture and ministers of education, and they tackled exactly this problem that you've mentioned. And the brick wall was, where do you get the funds from? There were lots of suggestions and very good ideas, but the problem was, where do you get the funds to implement these lovely proposals that we're hearing? That's what the minister said. And my take on this is that it should start from the countries themselves. The countries must show that they're willing to put some money where their mouth is. And unless they do that, they cannot expect the donors to take up all the slack. I believe that for that meeting, it was unfortunate that the ministers of health were not at that meeting. It was only Minister of Education and Minister of Agriculture of Africa. And we in 2007, we couldn't get the ministers, 3 ministers to meet, but we had the directors of medical services, the directors of agriculture together, and the directors of education. And part of their problem was that the rapid turnover of ministers within these sectors is a very big problem. I know at least two countries in my part of the world where within a 13-year period there were 15 ministers of health, and there were 7 ministers of agriculture, and 11 ministers of education within a 13-year period. So you don't have the continuity of policies, and this becomes a big problem. I think that's why in Anglophone countries you do have the permanent secretary. He's permanent there. There's that continuity to continue policies, but the ministers come and go, and the permanent secretary just said, "Wait, just wait. He will go soon. We'll continue what we're doing." I think that for me, the crucial point is that the countries themselves must show that they are interested, they are serious about developing capacity, no matter how small it is. And in developing such capacity, I believe that it should be a cross-sectoral capacity development, changing the curriculum for both agriculture, nutrition, and health. Being in university, we've and working with Helen Keller, I know you know this. We've been trying to do this in West Africa to try to change curriculum for the 3 sectors, and it's been very, very difficult. Now, the unifying platform, one of my things, my hope is that at the meeting in Delhi, we will find a unifying platform. That's my hope and my prayer, that we will find a unifying platform. But as you rightly pointed out, I think communication. We could start with communication. Let's start talking to each other. Let's start knowing what our problems are and how. Let's find a common agenda where we can both address this issue and have, as I said, to have a common message. If we have that common message that we all deliver, saying the same thing and not coming at different times saying different things, I think that will make a lot of difference. The sex ratio, the mortality, certainly this is something that needs to be addressed. We see this quite clearly in that the preference for boys to live more than girls, so they are fed better than the girls, and you have this issue of the feminization of diseases in childhood, which unfortunately is real, which we cannot run away from. Incomes, one of my pet projects now is to get farmers to put part of their income into their health, rather than marrying more wives. Get them to put some money into the health of the family. I think this is terribly important.
Thank you, Prabhu. You want to add something?
Thank you. I'm just going to pick up on 2 issues. Actually, 3 issues. First is the whole issue of human capacity development and the resources. I don't think we should start by saying where are the resources and we'll do human capacity development. I think we need to say what's happening on the ground today and how can we use existing resources to get better synergies across the sectors. There are huge opportunities to do that. Every time we start with resources, then we start a new project. And that new project ends the day the resources end. So let's not start with resources. I have a particular reason for saying that. On the unifying platforms, I think it's important to have unifying platforms at the level of the international community, having a uniform platform that can debate agriculture, health and nutrition in Washington, etc. But the really crucial unifying platforms are the ones that need to take place at the country level and at the local level. And there's very little effort going on. Just think about this. CARDEP framework for agriculture is very much an agriculture framework. It doesn't have a real clear integration of nutrition in the Cardiff framework. Now, unless you influence the Cardiff framework, you're not going to reach the policymakers in sub-Saharan Africa to see how you can integrate agriculture and nutrition at the country level. And I think as we talk about unifying platforms, let's focus on getting them to happen at the country level. The third point I'd like to make is on the food processing issue. And here we have a really unique opportunity in history now. And the reason for that is because of the rapid spread of supermarkets taking place across the developing world. It's just mind-boggling at the rate at which supermarkets are spreading across Asia. But it's also true in Africa. You're beginning to see much of the urban food supply taking place through supermarkets. And because of that, there's a big revolution taking place in the processing industry. And because in many countries in Africa, the processing industry is so much more underdeveloped, you see much of the supermarket processed food coming from outside the countries rather than within the countries. Now, if you can work on the processing industry domestically and figure out a way in which processed food and food delivered through supermarkets is more micronutrient dense through fortification programs or through better diversity of the food supplied, etc., then we have an opportunity there. And that's something we need to look at more carefully. Thanks.
Thank you, Prabhu. Marie?
Just a few very quick comments. That was the whole idea of having the other speakers provide all the answers first. There's not much left to say. One thing that I feel in terms of capacity, I obviously understand the need for capacity at the local level or at the regional level. We also have a really big capacity problem at the level of high postdoctoral fellows and above. When you look for a really good nutritionist, they usually don't know anything about agriculture, and when you look for a really good agriculture person, they don't know anything about nutrition. We're trained to specialize. We're trained to be expert at a very narrow area. The other point related to that is also when you publish in journals that accommodate work across sectors. Those are not the best 10 journals or the best economic journals or nutrition journals. So we really also have to do our homework there, and I think it's the beginning of a unifying platform as well. And there is one initiative in the London schools, the Lever, I can never pronounce it, the Leverhulme Integrated, what is it called? Leverhulme Center for Integrated Research in Agriculture and Health. It's a new initiative that brings together 5 or 6 university colleges in London and is specifically going to train people in the multidisciplinarity of agriculture and health. There's also the Cornell and Tata Foundation, which is another initiative that is training people in agriculture and nutrition, specializing or focusing on Indian professionals. So there are also needs to train people at the higher level in more multidisciplinary approaches and methods and understanding. And the other point I wanted to answer is your point, Barbara, about the 1,000 days and the maternity leave. I hope we don't start that at IFPRI. We're going to have people gone for 3 years, but it's a real problem in developing countries. We can't even deal with the exclusive breastfeeding of the first 6 months. Nobody is off for 6 months, and most women in developing countries that work in maquilas or in factories, they can't bring the child to work. They have 2 weeks to deliver and get it over with, and then they're back on the job, and there's no way they can exclusively breastfeed. So we have a long way to go to have systems in place, policies that will favor really in a meaningful way the 1,000 days.
Thank you. I can take, two more questions fast. Yes. So there's a microphone coming your way.
I think this is a question for Prabhu, but so I know about the Gates, I mean, I'm aware of the Gates Foundation, a big global health initiative, and so on. And your bent is more on agriculture. So, but what I kept thinking about during the presentation was what I've heard about people being treated with antiretrovirals in Africa, and how most of the time they die from malnutrition because taking the drugs does does a lot of damage to your system. So if you're not eating properly, you probably need to eat more. So I wonder if that initiative takes into account also agriculture and nutrition.
Thank you, Mr. Chair. My question is specifically to Prabhu. On his definition, comprehensive definition about malnutrition, including undernutrition, that is hunger, imbalanced consumption of different nutrients, and then obesity. If he would venture to make a composite index of all this, these three different parts, what weights would he attach depending upon the need of the body, or the individuals we are concerned with, poor especially? And secondly, if then he runs the regression of looking at what is the impact of agriculture growth on this composite index, would he expect an elasticity of 0.01 or something 0.5, or any guesses on that, or any research that you have in your pocket? Thank you.
Prabhu, anything in your pocket besides money?
David had that comment.
Go ahead,
Ashok, I can do that on my flight back to Seattle tonight. Let me talk. I think the idea of a composite index is useful, and I thought the hunger index is sort of moving in that direction. I think the hunger index is facing the weights problem. But let me just make a very off-the-cuff remark here without getting into econometrics. My off-the-cuff remark is the weights will probably change relative to the stage of structural transformation that the economy is in. So if you're in countries that are way at the low end of the structural transformation process, then the weight that you would give to the undernutrition component would be much higher than the weight you would give to the obesity component. But as you go through that process of structural transformation, and as you get to the middle income levels, then the weights change quite dramatically. The malnutrition part of it will probably be relatively fixed for a long time to come. Maybe we should put somebody on to check this out. But that's my off-the-cuff comment on that. By the way, one of the peeves I've had with the nutrition literature is that they just don't understand structural transformation. And so maybe we need to get the structural transformation people and the nutrition people to get together more often, because the strategy you use depends on the stage of development you're in. On the Gates Foundation itself and our work on agriculture and the health side, and specifically the question on the antiretrovirals. Actually, the health program of the Gates Foundation is over 10 years old. And the health program has had a very intensive set of activities around HIV, AIDS, malaria, TB, etc. And the large part of the health program's initial work was around vaccines and drugs, etc. And the agriculture program started 4 years ago. Actually, we formally started in 2008. And quite often people ask me, why did the Gates Foundation start an agriculture program? It's because we started the agriculture program before the food price crisis took place. We're very proud of that. That we started before the food price crisis took place. So we actually came into this with a feeling that this is an important area before everybody started to say, yes, this is important. And the reason for that is that as the work on health was proceeding, it was quite clear that unless you address the chronic problems of hunger and poverty, you were not going to get the full benefits of the health interventions. And so the idea was exactly what you said, that unless you have food and food security, your ability to be able to tackle the broader health problems would be limited. And that's how the foundation started to think about how do you address chronic hunger and poverty. And agriculture was seen as a primary engine for doing that. That's how we got into the agriculture program. Now where we are today is to figure out how we can all work together to try and come up with a comprehensive nutrition program and look at the interaction between agriculture and nutrition there, and also looking more broadly at the health issues. So.
Thank you. Yes, Kaba. Fast one.
Just to mention, you have the Gardens for Health in Rwanda and Kenya, and they're addressing exactly that problem of people living with HIV/AIDS are being encouraged to have little gardens, backyard gardens and so on. 6 months ago, I was in Kenya and I visited some of these gardens, these people living with HIV/AIDS, and they're very, very impressive. And just to really respond to your concern, the funding for, at least for the Kenya group, was from Sweden, the CEDA. They were funding the Gardens for Health in Kenya. I don't know who's funding the Rwanda one. Well, it's a program that's been going on between, and they hope to spread this to the rest of Africa.
Join me then in thanking our excellent speakers, Prabhu, Kaba, and Marie. Shingen is going to give us some closing remarks.
Well, let me join Fazi to thank three excellent speakers for a very exciting discussion. As you know, it's the first time we bring three different areas of expertise together. The typical agriculture economist, hardcore nutritionist, converted it to almost an economist. And we also have a health expert here, pediatrician. I have three key messages and some of the forward research topics. The first, growth is a must. Without growth, we won't have any money to finance any health, any nutrition programs. So we need to grow. Second, agriculture growth is also critical. As Prabhu said, there is a transformation process. When the economy begins to take off without agriculture growth, then the economy just couldn't take off. This is the clear evidence from Asia. The Green Revolution provided fundamental ground for the overall economy to take off. However, agriculture growth are not sufficient. India's experience clearly showed us the other factors matter. Care, health. So I would call it growth plus, agriculture plus. So we need all these pluses. So they are not efficient by themselves. Now, in terms of the research gaps, as a former researcher, I always like to think, what could I do next from this workshop or from this seminar? The first one is the growth patterns really matter. The growth is a must, but where does growth come from? Whether growth comes from stable crops versus non-stable crops, whether growth comes from livestock sector, whether growth comes from smallholders versus larger holders, whether growth comes from women-headed households, whether growth comes from some tribal areas, less favored areas. All this really matters. You cannot just use a growth as one number, or 10% growth, 8% growth. No. The composition really matters. And the IFPRI's research, some very preliminary research in Tanzania, has already showed that. So growth from different crops, whether it's from maize, from beans, or from cassava, have different implications on nutrition status of the family. The second is where we have heard about externalities in that link, health problems, environmental problems, lack of micronutrients in crops. So how can we design certain policies, instruments, internalize these externalities, or these economics terms? So can we use a tax, for example? Okay, certain very fatty food, unhealthy food, can we impose a tax and use that tax to subsidize nutritious food, more nutritious food? It's not new, but how we do it. Can we use a trade as an instrument for promoting that? This is my second research area that we could tackle in the future. The third one is that we know we need a comprehensive approach. Growth, agriculture growth, interventions, nutrition interventions, health interventions, care, women's education, girls' education, all this matter. The question is, how do we sequence, how do we set the priorities in allocating the limited resources? The public resources are very limited. The market is not going to work, so public interventions are needed. Those priorities, sequencing, really matter, critical. The fourth area is culture. We have not mentioned much about the culture here. The culture plays a critical role in that link from agriculture growth, from agriculture to nutrition. For example, intra-household allocation, the diet behavior. When many societies have the tendency to eat one food versus another, and consumption behavior. For another poor, well, they would have their cell phones instead of buying nutritious food. So can we do something to change the culture, all this behavior? Then, finally, probably the most important is accountability. We know that we wanted to achieve better health and nutrition outcome. How can we make somebody accountable at different levels? It's at global level. Can we make certain agency somewhere in Rome, in Paris, or Washington accountable for the global health nutrition? I don't think we have a system now, but I'm glad to inform you that CGIAR takes that business very seriously. So among a dozen mega programs or consortium research programs, one mega program is to link agriculture to health and nutrition. So can we make CGIAR accountable for nutrition and health outcome? At IFPRI, we have probably the largest concentration of nutritionists among all the CGIAR centers. And can we make IFPRI accountable for that? Then, more importantly, is the national level. Prabhu mentioned that, well, we needed to move down to national, even community level. Yes, this is critical. Can we make Minister of Agriculture accountable for nutrition outcome, health outcome, instead of food self-sufficiency? Instead of the yield target. We do like the yield target, but that's not sufficient. So in summary, another global change, such as climate change, increased population growth, even the urbanization, all this presents risks, potential risks to us. Probably some of the trends will make the poor even more poorer and make many people undernourished. But in the meantime, it also presents opportunity to urbanization, increased population. So let's work together, three different communities, health, nutrition, and agriculture. Let's work together to starting from now, let's change our mind and begin to act. Thank you very much.